I'm Keith Dahlhauser. I'm one of the partners, ophthalmologists at Cascade Eye and Skin. We have other surgeons that do refractive surgery along with me. Dr. Brady, who's been here for just about as long. I've been at Cascade since 2004, doing cataracts and refractive surgery. Cataract surgery is a way to refocus eyes too. That's kind of refractive. Doing cataract surgery on somebody who doesn't have a cataract yet, that's called a refractive lens exchange, so we do that. And then we do LASIK and PRK. Those are two different techniques to refocus the eye using the cornea, the surface of the eye. LASIK is the common one that most people understand. And we also have Dr. Chen and Dr. Godbole, who also have many years and thousands of eyes experience doing refractive surgery. When you have a consult at Cascade Eye and Skin, it's a free consult. You'll come in and we'll scan your eyes to look at the shape of your cornea. We will take a history, make sure you don't have any other eye disease. We can't do LASIK or PRK surgery if you have cataracts, dry eye, or other significant conditions. So we got to screen out those things. We look at the shape of your eye with a computer scan that can rule out some things and do a thorough history and exam. The surgery for LASIK isn't done based upon the game 1 or 2, what makes your vision better. It's done based upon a computer scan of your eyes the day of surgery. So it's okay to have your contact lenses in at that consult, but you have to be out of a contact lens for 2 weeks before any refractive surgery. And then we scan your eyes that day and then do the surgery based on that scan. The difference is when we do it based upon the glasses prescription, it just looks at astigmatism and nearsighted and farsighted. But if we do it scan-based, computer scan-based, that's called wave scan, eye design, then it's 25 times more accurate than doing it based on a glasses prescription. It looks at the shape of your eye, and if there's little elevated spots, it'll smooth down those areas to give a better focus. A common question people ask is LASIK permanent? It is. I had my own eyes done 24 years ago, and I still see in the distance the way I did back then. What happens as you age, though, you lose the ability to focus up close, and so you're going to need some readers to see things up close. So that's what these are for me. Once you turn 45 or so, that's when you start needing readers, so there's no way around that. We do have ways with LASIK where we can focus one eye at near and one eye at far. So if I did LASIK on somebody who's already 50 years old, I could give them near in one and far in the other, so that would be a way to not need readers as much. At the consultation, you'll have your eyes dilated. So you might want a driver to take you home. It won't be that blurry when your eyes are dilated. The day of surgery is done in our Puyallup office. And we have a climate-controlled, temperature-controlled environment in our Puyallup office. So you'll come in with a driver. For sure you need a driver that day. It takes about an hour experience. When we start going with the surgery, it's about 10 minutes per eye. The first minute is the hardest part. The first minute is where I have a little suction device I'm going to use to hold your eye steady. That suction device gives you a pressure on your eye, like I'm pushing really hard. Your vision kind of darkens out because of it. So for 1 minute, you're going to feel like I'm pushing really hard on your eye as I hold it steady. You don't feel sharpness, you don't feel the laser, you'll just feel pressure as I hold you for the laser to be done. That lasts for about a minute. And then the rest of the 9 minutes per eye is not painful. Afterwards, your eyes are going to feel like I threw some sand or gravel in them. So you'll have an irritation on your eyes. The best way to make that feel better is to go home and take a nap for 3-4 hours. We give you a Valium tablet to take before the surgery to kind of take the edge off, and then you can take another one when you get home to help you sleep. You have drops to take if you're awake, but it's better just to sleep. After the irritation goes away, then you start feeling pretty good later that night or sometimes into the next morning. Your vision does the same thing. It's kind of foggy, like looking through a shower door right away. Then after a long nap, then it kind of sharpens up. And the next morning when you wake up, it's usually good enough vision that you can drive yourself to come see us in the office. We have to see you the day after LASIK. The post-op care for LASIK or PRK is drops that we'll give you ahead of time. One's an antibiotic, one's an anti-scar. There'll be no rubbing on your eye, so we don't want you to rub hard. During the day, you have to remember to keep your hands down. The first day after surgery, I'll give you some goggles so you don't accidentally rub your eyes. And then you wear the goggles every night you go to bed for a week so you don't accidentally rub. But the next day you can go back to normal activities. I was seeing patients the day after my own LASIK was done. So you don't have any restrictions. We don't want dust and dirt in your eyes. So if you're like you're gonna go run outside and the dust is blowing up in your face or you work in a really dirty environment, we'd keep you out of that work environment for a few days. But a desk job, you can go back right away. LASIK takes about an hour experience to be in the office, but once we bring you back and lay down on the table and get about ready to go, it's about 10 minutes per eye to do. The downside of LASIK is that it can cause some dryness. So that's one of the things we have to do, is make sure that you don't have any dryness before. Now, maybe your eyes are dry because you've been wearing contact lenses and that gives you some dryness. So if you stop wearing your contact and your eyes feel comfy again, then you are a candidate for LASIK. But if you are day by day feeling dry on your eyes, we don't want to do LASIK. That's the biggest downside. That's one of the main things we got to screen out. So during your exam, we'll be putting dye on your eyes and looking at the surface and making sure we don't see dry spots. Glare at night happens to most people for a few months after LASIK. But after a few months, then that settles down and goes away. They did a study looking at glare and how much glare we caused by doing LASIK. Early LASIK, before we had custom treatments and laser-made flaps, we actually caused some glare. But nowadays, with modern technology LASIK, we usually reduce people's glare by just a little bit on average. The chance that something happens that leaves a blur behind that can't be fixed is about 1 out of 1,000. So a blur that even with glasses or contacts or more surgery, I still can't make it better, that happens to about 1 out of 1,000. Why? Maybe some flap-related damage, maybe an infection resistant to my antibiotics. So something leaving a blur behind. So that is the risk of LASIK. There's no perfect LASIK surgery. There's no surgery that's perfect. LASIK is approved for astronauts and pilots, so they can get it done. They think it's low enough risk that they'll train these guys to go to the space station, and they still let them do LASIK, so it's not crazy risky. But it is a risk I took to my own eyes when I had mine done years ago. And the technology of LASIK is even better than when I thought it was safe 24 years ago.